Hi, this is Fix My Fibro and my name's Bernadette. This video is called Nasty Nurses, and I want to talk about how sometimes people in the medical community, namely nurses and even doctors, treat you exceptionally poorly and actually say really nasty things relating to your symptoms because they don't understand the illness, because fibromyalgia has never been correctly characterized, and because your symptoms aren't in control and you're not getting the appropriate treatments for the symptoms that are going on, you will get nasty retorts from different people in the medical community. I have two friends that are nurses, and I can say in my 2+ decades of illness, the nastiest comments I've received and the most hurtful have actually been from those nurses. One was early on in my disease presentation when I had severe polymyalgia rheumatica symptoms because my MCAS, the mast cell activation, was severely activated. All these cytokines were coursing out of my arteries, all my arteries were severely inflamed. And I had classical polymyalgia rheumatica and temporal arteritis, which is inflammation of the temporal arteritis is inflammation of the small and medium arteries of the head and neck, and polymyalgia rheumatica is inflammation of the arteries in the torso, which are large to medium. Now, the treatment's slightly different for each of those illnesses, but they're both really, really debilitating. It's when you're chronically bedridden, you're in physical agony. But because you don't meet the diagnostic criteria for polymyalgia rheumatica and temporal arteritis, they're believed to only occur in elderly over 70. So when you're not over 70, I was 29 when my illness set off, I just get told, you're too young. It was almost ageism, not sexism, but ageism. Because I wasn't old enough, you just can't have it. There aren't any blood-based diagnostic tests to determine those illnesses, but by taking steroids or corticosteroid prednisolone, or prednisone as it's called in America as well, in a shortened name, that drug tones down your immune system and blocks the cytokine production or the cytokine release and really improves the symptoms. It's like a miracle treatment. It's amazing. After taking it, within 2 or 3 days, you can move again. Sure, they have severe side effects, those drugs, but they're the only drug that works for that condition. But because you're not recognised that your polymyalgia rheumatica or your temporal arteritis symptoms, which get called TMJ, temporomandibular joint, TMJ is the temporomandibular, that's your joint there in your jaw. You get severe locking of the jaw, you get severe migraines, like mind-blowing migraines. I remember screaming at a doctor when it first started saying, I feel like my skull's going to explode on you. I'm not making this up. Please prescribe me these steroids. And he did. But I was told that, I shouldn't be on them afterwards because I was too young. I couldn't possibly have it. I didn't have a high ESR in my blood, which is a marker that rheumatologists use for inflammation in some rheumatological conditions. So because I didn't have a high ESR, which was the only blood-based parameter related to that kind of inflammation, but it's not actually specific to polymyalgia rheumatica or temporal arteritis, that caused a massive issue. Anyway, going off track, that's another video to talk more about PMR and TA. But the thing is, these nasty comments, so I was told I was an idiot for taking steroids to manage that condition. I had a rheumatologist treating me. I have always sought specialist help right from the outset 25 years ago. But even she wouldn't say that I had polymyalgia rheumatica and temporal arteritis. She just said, sure, she was treating me and managing me on the steroids. But when I would then have these massive gouty attacks on top of it in my elbow, I remember visiting her for an appointment and she'd say, you can't possibly be having pain in your elbow on that dose of steroids. Well, I was, dear rheumatologist, but she wasn't acknowledging it and didn't realise that that's a separate biochemical process. This purine issue that we can't process purines effectively was causing additional pain attacks in my joints where I couldn't walk, my ankles, I'd need to use a walking stick or a walking frame, or I'd be completely disabled with these severe gouty-based attacks because I didn't realise at that time that purines and an excess of purines in my diet was causing it. So back to the nasty nurses. Sorry, nurses, but I've got to talk about it because us fibromyalgics cop it on a daily basis and get treated like crap and gets, really nasty retorts said to us, oh, you can't possibly be in that much pain. Oh, you can't, oh, it's because you're fat, it's because you're not exercising, it's because this, it's because that. The things that get said are absolutely diabolical. I could do 100 videos on all the nastiness that's been communicated to me in the past decades relating to my symptoms. I can honestly say I have barely voiced 5% of my symptoms that I suffer. And even that little bit that I've voiced always comes back with nasty retorts from specialists, from nurses. Another one of my nurse friends, has said things to me like, oh, stop obsessing over your symptoms. I'm not obsessing. I have symptoms every single day because of my fibromyalgia. There's over 200 symptoms, and I will, without fail, have 10 symptoms a day if I'm not managing it, which I've learnt to do now because I've figured out all these triggers and figured out the disease processes behind the illness. So the thing is, I know how many of you have been upset by doctor's appointments. I too, in the early days, you'd wait 3 months for an appointment with a new specialist or an appointment with your GP. And you'll go in there and you'll say, I'm having these severe gut issues. I'm having, just severe debilitating pain, fatigue, everything. And you'll leave that appointment and nothing will get resolved. You'll get turned away. You end up going home. You get in your car. You drive yourself home. You cry for the next 24 hours because of the helplessness you feel, because you're not diagnosed, you're not recognised for your symptoms. The doctors don't understand what's behind the symptoms of fibromyalgia. They don't understand the disease processes that are faulty, that are causing the symptoms. Therefore, you don't get diagnosed, you don't get treated, and then you are treated like crap, for want of a better word, by people in the medical community telling you that it can't possibly be that bad. I've even asked for help from some of these friends when I've been chronically ill. Last year I had a severe bout of a gastro bug. It set off a massive MCAS immune response in my body, severe gut inflammation. I have never before in my life pooed out just pure gel. Like, the severity of the inflammation in my gut was that there was no food in there. I hadn't eaten for a week because of the severity of the gastro, the severity of the diarrhea. But, I couldn't even leave my house to go out and get basic supplies. Asked for some help. It was never forthcoming. It was like, I'll just get over it. And I had to actually go out to the shops on my own a few days later, and pooed my pants getting out of the shop trying to lift bags into my bag because of the severity of the inflammation. So these things happen. It's really disheartening. It really hurts your feelings. It changes the way you feel about certain people because of the way they treat you. But we've all got thick skins, because if you've got fibromyalgia, you know exactly what I'm talking about, and you know the severity of the symptoms you suffer at times when you have repeated illnesses or different illnesses, setting off and activating your symptoms. And it's really unfortunate that the medical community does not understand the basis of these fibromyalgia attacks and the basis of potential treatments. And that's something I'm hoping to change. So I'm really sorry that you've had to go through this kind of nastiness, but it really is based on their inability or their lack of knowledge and understanding on the condition. And it's a little bit of ignorance, not their fault. People don't understand it. I'm hoping to change that. So all I can say about the nastiness is you have to let it go. and you just have to manage your symptoms and deal with what's going on with your illness to help manage it. And hopefully these videos will give you lots of insights and lots of improvements in your daily fibromyalgia symptoms. Thanks for listening.